Hello everyone. In this video lecture we are going to discuss about frontal bone. Frontal bone is the bone present in the skull. Now skull is the this is the skull of an ox. Skull is the part of axial skeleton. In skull we have further two types of bones. The first one is the cranial bones present in the cranium, and the second one are the facial bones present on the face. Now frontal bone is a cranial bone. Frontal bone, this particular region of the skull is where frontal bone are present, and frontal bones are the paired bones. You can see there are two frontal bones on the dorsal side. Animal head would be present like this, so this is the dorsal side where frontal bones would be present. Now they are united by this plain suture which is known as interfrontal suture. So interfrontal suture on the dorsal side articulates these two frontal bones with each other. Now each of the frontal bone encloses some cavities like this. You can see these are some air cavities to reduce the weight of the skull, and these cavities are known as frontal sinuses because they are present in the frontal bone. Now frontal bone is classified or divided into four segments. First one is the frontal squamma. On the dorsal side or on the dorsal aspect, you can see these frontal bones here. The dorsal aspect of frontal bone is what makes the frontal squamma. Now in while talking about orbital part, orbit is a region or a cavity where eye is present, and the majority part of the orbit is formed by the frontal bone like this part. So the region of the frontal bone which is involved in the formation of orbit is known as orbital part. I will repeat, that part of frontal bone which is involved in the formation of orbit is known as orbital part, and that part of frontal bone which is attached to the temporal bone is known as temporal part, and that part of frontal bone which is attached to this nasal bone is known as nasal part. So this is the nasal part of the frontal bone, this is the frontal squamma, this is the orbital part, and this is the temporal part. So these are the four parts in which frontal bone is divided. Now while talking about frontal squamma, what are the things we need to keep in mind? It is frontal squamma is rostral part. Now what is the rostral means? Rostral means close to the nose. You can see this is the rostral part, this is nose, and this is the rostral part of the frontal bone which is as frontal squamma. Now there is a particular term known as zygomatic process. See, this is the orbit, and in orbit this particular region would be the dorsal part. So dorsal part of orbit has a process kind of a thing. It is dilated outwards, and that dilatation or that process present on the dorsal side of orbit is nothing but a process that is known as zygomatic process. So zygomatic process is present where is it is present on the dorsal side of the orbit region. Okay, and this zygomatic process is very much essential in making a joint between the frontal bone and this particular temporal bone, or sometimes zygomatic bone in case of ruminants. As I said, in ruminants the zygomatic process of frontal bone, this zygomatic process of frontal bone articulates with frontal process of zygomatic bone. This is the zygomatic bone. See, frontal bone would be having a zygomatic process, and zygomatic bone would be having a frontal process. They are articulating to form the orbit. But in equines there is no role of zygomatic bone, there is a role of temporal bone. Temporal bone take part in this. So in equines zygomatic process of temporal bone joins with the zygomatic process of frontal bone. But in case of carnivorous and pigs, the orbit is not completely covered by the bones. In the dorsal aspect, it possesses orbital ligament. Like you can see, this is the dorsal aspect, and here you can find the orbital ligament. You will not find the articulation between zygomatic process and frontal process. So orbital process of zygomatic bone or zygomatic process possesses a depression. You can see in the dorsal aspect. This is the dorsal aspect of any animal. In that dorsal aspect, you would be having zygomatic process. This is the dorsal aspect, and here you would find zygomatic process. Inside the zygomatic process, there is a depression for a gland to get fit, and that gland is lacrimal gland. Like you can see here, this is the lacrimal gland, and it would be covered by the zygomatic process of dorsal part of orbit. But in equines, this zygomatic process is having some perforations, and that is supraorbital foramen. Now what it is saying, there are two things which we have to remember about this supraorbital foramen. Firstly, in case of ruminants, this is the supraorbital foramen, that is foramen present on the superior side of frontal bone. Now this supraorbital foramen is present medially on the dorsal aspect of frontal bone. This is medial region, and it is present on the dorsal aspect of the frontal bone. This is supraorbital foramen in case of ox. But in case of horse or equines, this supraorbital foramen is very close to the zygomatic process. As in equines, zygomatic process at its origin is perforated by supraorbital foramen, but in pigs and ruminants, supraorbital foramen lies more medially on the roof of the skull, like you can see here. But in equines, it is present on the zygomatic process or very close to zygomatic process. Now, this supraorbital foramen opens into the orbit via canal. This is known as supraorbital canal, which is absent in carnivores. And here is a ridge kind of a thing, which is known as supraorbital ridge. Now, frontal squama is separated by temporal surface by the temporal line. See what it is saying. This is the frontal squama, and this is the temporal bone. You can see they are separated by this temporal line. This is the temporal line, and this temporal line has a various significance. Firstly, what is this temporal line? It is the line which separates the frontal bone from the temporal surface. This is the temporal surface, and it is separated by the frontal squama via this temporal line. Now, during the dehorning of the animal, what happens? Temporal line is used as a landmark to block the corneal nerve. Now, corneal nerve is a nerve which is supplied to these horns. Now, if we block that nerve, so we can easily dehorn the animal. So what is the landmark or location of this corneal nerve? It is present just close to the temporal line, as you can see in the animal. This is the orbit of the animal, this is the temporal line, and here you can see corneal nerve, and here we give the nerve block. As you can see, doctor is giving nerve block to the corneal nerve. Here you can see it is present on the temporal line. Now what is this corneal process? It is present immediately behind the orbit. You can see this is the orbit, and this is the corneal process from which the horns arises. So it is just present behind the orbit, and it is nothing but the extension of frontal sinus. I showed you frontal sinus just initial on this video. This was the frontal sinus, and it gives the horns after some time, or corneal process, which are marked by some septas also. If you will look inside a horn, you will see certain bones, irregular bones there. Now what is this torus frontalis? You know, this frontal bone on its posterior or caudal side is somewhat have an eminence kind of a thing, an elevation kind of a thing, and that elevation is known as torus frontalis. What it is known as? Torus frontalis, which you can see here, it is an elevation kind of a thing, that is known as torus frontalis. This elevation is torus frontalis. So this was all about the frontal bone. Thanks.